Although it may not be the most sought after vegetable, the ancient Hebrews complained bitterly about it, of not getting to eat after they left the land of Egypt. Our vegetable for discussion today is cucumber. I am excited to be in your homes tonight to share some information with you. My name is Barbara Hammond, the host of Welcome to My Kitchen. You don't want to miss this. So please call a friend, call a loved one, and let's educate ourselves. We are supported by Handy Honey. Handy Honey has been a faithful supporter over the years. Please, the little you can do is to patronize him so he can continue to support our program. Thank you and stay tuned. Welcome back. So to do the education with me is Dr. You're not doctor yet?
I'm not doctor yet.
All right, so nutritionist, dietitian, what else?
And also researcher.
Introduce yourself to my viewers, please.
Hi everyone, my name is Enoch Sam Esiedu. Yeah, so I'm a dietitian and then I'm also a researcher. My study interest is weight management and then pediatric nutrition. Yes.
Nice one. Welcome once more.
Thank you very much.
Yeah, so today we are talking about cucumber.
Yes.
I know most people don't like it. I don't know why. It's not that tasty. It's not bitter. I don't know why people don't really like it, but of late is that it has become very popular.
Yes.
So we want you to educate us, especially how we can use that to manage our weight.
Okay. It's very important you've mentioned that it was something that people were not paying attention to. You know, right now bringing it to the spotlight where people have seen the nutritive value of it. A lot of people who are health conscious are now subscribing to the consumption. The cucumber is very, very important when it comes to weight management, I rightly said. This is because it has dietary fiber. And this dietary fiber has enormous importance when it comes to weight management. One of it is it's able to make you feel full for long. So for instance, if you are taking good amount of cucumber in the morning, it will take a long time before you feel hungry. And the dietary fiber in it too is able to mobilize extra fats in the body, get rid of them through the excreta. And then again, the dietary fiber in it to help prevent constipation and all of that. So that's one of the important things that it brings to the table when it comes to weight management. And aside that, if you don't eat it in isolation, but then you add some other foods to it or fruits to it, like maybe apple to it or maybe to ginger to it, it makes it very, very good in the weight management processes.
Okay.
Yes, please.
Interesting.
Yes.
So tell me, what's wrong with weight? Why should I manage my weight?
Okay. That's a very good question.
Yes. What is it? Every weight loss, why should I manage it?
Okay, so there's actually something we call weight perception. So weight perception is when you have an idea of how your body looks. So it's subjective.
Okay.
So weight perception can be positive, can be negative. So a negative weight perception is when you think, oh, you are normal, but then according to the BMI, right, body mass index, okay, with WHO standards, okay, according to that you might be overweight, but then you think you are normal. So in that case, you have negative weight perception.
No, it's not that you think, you know.
You know.
I know I'm normal.
So you see, if you know you are normal,
I know.
yet according to the BMI cutoff, you're overweight. You know.
Can you imagine?
Yes. And the interesting thing is, you see, when you have negative weight perception of yourself, it predisposes you to a lot of chronic diseases. Yes. So my study, during my study, I just conducted a study and in Accra metropolis among women from 18 to 65 years. And I realized that when it comes to weight perception, weight misperception, I had, I think, around close to 80% of them misperceived their weight. They were thinking they were normal. But according to the measurement, the standard measurement, they were obese.
Don't tell me I'm one of them. I'm normal.
I wouldn't say that until maybe I've done the necessary measurements to find that out. Yes. And then when you're obese, it's actually a form of chronic disease.
Obesity?
Yes, it's a disease according to the WHO, World Health Organization.
I see.
Yes, and when that happens, it brings diabetes and hypertension in there, and that is a very big health problem. So right now, the first about decades ago, underweight was a problem when people are stunted and all of that. But now, it's overweight that's a problem because yes, it leads to a lot of mobility and mortality in the world.
How do we prevent those overweight? How do we do it?
Yes. So first, it will take a conscious effort.
Conscious effort.
Yes, conscious
Discipline.
effort. Exactly. So first, you have to accept that this is the body you have, and this body is putting you at risk of other diseases that can really have negative effects on your body. So to be able to do that, then you now have to go look for a nutritionist or a registered dietitian, not a quack dietitian, a registered one. Yes. So the dietitian will take you through, you know, in dietetics, we don't really tell people don't eat that. We modify the food for them. Yes. And we help you make informed choices of the food, the normal food you eat, so that it will help you. Okay, for instance, the cucumber we are talking about, when you go in there and you want to lose weight, the dietitian will never take it off your plate. It will be something that must be incorporated in your diet so that you'll be able to manage your weight.
I see. So does obesity affect patients for surgery?
Yes.
It does?
Yes. Most importantly, before any surgical procedures are undertaken, they have to make sure that you are of good health before that can be conducted. So a situation where you have too much fat in a particular part of the body where it must be cut open and maybe perform some surgery in there, you have to get rid of that. Okay, so weight management is also key, especially with CS. You know, when you have a lot of fat around your lower abdomen, you need to get rid of that before they can cut in there and bring out your baby.
How serious is weight gain disease, obesity? You say it's a disease,
yes,
right?
It's
How
a disease.
serious is it?
It's very serious because obesity is the major risk factor. Let me just make that emphatic here. It's a major risk factor when it comes to development of hypertension and then coronary heart disease because of the blockage. You see, the fat in the body can block the blood vessels, that's the veins and the arteries. And when those blood vessels are blocked, blood does not get to the point where it's supposed to get in the body. As a result, there can be a lot of problems.
How do we manage it? How do we reverse it?
Okay, it's good because it's one of the few conditions where when you get, you're able to reverse it. You see, so one of the most important thing to do is to exercise. Okay. Exercise is very important, and then you pay keen attention to your lifestyle and dietary habits. Alcohol is also known to cause a lot of cancers. It's because, you know, the typical spirit, when you pour it on the ground, within a matter of seconds, you see that all of it will just vanish like that. So it just has ability to, it's very volatile. It sort of disappears into the thin air. And that's what happens in our body. So when you are taking those spirits, and you know, it's not everything in food that is okay for the body. Okay, so it's able to mobilize all of that and then bring them into the body cells. You see, so alcohol is actually known as a major driving force when it comes to cancer development and other things. So that must be taken into good consideration if you want to manage that.
You know, in our parts of the world, dietitians and nutritionists are not always present in our hospitals. I've noticed that lately we are working on that.
Yes,
so assuming I'm a patient, I'm obese, and I've come for help, walk me through.
Okay. Yeah, so that's the nutrition care process. We call it nutrition care process.
Nutrition care process,
yes. And it follows the ADIME. ADIME means A-D-I-M-E. Okay, so you have ADIME, that's Anthro. Okay, Anthro. So that's where we do your body measurements and other things. And you have the D, that is diagnosis. So from the Anthros, when I take your weight, your height, your skin fold, we do a lot of assessments. But in Ghana, mostly we just do only 2 or 3. But when you go to a good hospital, they will run you through a lot of anthropometric measurements. Then we do the diagnosis. After that one, then we do intervention. The intervention is based on the diagnosis we've made. Okay, sometimes the person is obese, but it's not just normal obesity, it's central obesity. when we say central obesity, it means that there's accumulation of fat around your lower abdomen, around your stomach, and that is known for causing type 2 diabetes. Yes. So when you come and you're able to make that diagnosis, then we give you the next one is the intervention. The intervention is when we tell you, okay, you have to take portions of this, portions of that. The intervention is very broad. We have portion sizes where, based on the anthro that we've done, okay, maybe per your body, you're supposed to take maybe 200 or maybe just rough estimates like 2,000 kilocalories. But then the dietary whatever we've gained, you are taking like 5,000. So we help you tailor that down to the 2,000
calories.
Yes.
Cut this, cut that, add this, add that.
This, yes. But then, you know, when we ask you to cut it, because we don't want you to get hungry, we get substitute for you. Okay. So if you are saying that, okay, the bankun, don't take like this, okay, we ask you to take half of that and take more okra soup so you don't feel hungry. And okra too is very rich in dietary fiber. So in a way, we are helping you manage it by giving you the exact quantity, but then the quantity in there is not calories. It's rather maybe fiber or other nutrients.
Are you expensive?
Should
I come to you to help me? Are you expensive?
No.
You are not.
No.
Let us have your number so we can reach you.
Okay, so
you are not ready for us?
Oh, I can do that.
Please do
that. Yes. So my cell number is 050 3536 138. 050 3536 138.
I'm sure you do online services.
Yes.
I can be in Kumasi, reach you, and you take me through, right?
Exactly.
Great. Thank you for staying with us through the education. We are stepping out to the kitchen to put together a simple remedy to help you lose weight. Stay tuned, we'll be right back. Welcome back. So we are here in my kitchen, and as our custom is, we don't educate and leave you. We are going to prepare a healthy remedy to help with help us lose weight and lose these fats around our hips and thighs. We call it cellulite. Okay, so as I go into the preparation, my nutritionist here will take us through the benefits of these ingredients here. So let me walk you through. So our star ingredient for today is cucumber, and we have lettuce, we have apple, green apple, we have ginger and lemon. These are the ingredients for the remedy. So I'll start working on the vegetables and you give us. All right, so cucumber. Yeah. Yes.
Wow. Okay. So cucumber has a lot to offer us. I mean, in terms of our nutrition. Yes. See the way you are peeling it. I would advise that if I'm supposed to consume it, I won't even peel it, because the green pigment over there is rich in vitamin K. Yes.
Let's pause it right there. My challenge. My challenge is that I don't know the source of this beautiful vegetable here.
Yeah.
And so in as much as it's been washed and cleaned, okay, so I shouldn't peel it.
Oh yeah, you can choose to peel it or not. Yeah, but then one great component that sometimes we tend to miss out when we peel it off is the vitamin K. And vitamin K is good for bone health and other things. But then, of course, if you don't trust the source, you can peel it off. But then it shouldn't be all the time.
All right. Yeah. So today we'll peel it off. Next time, don't peel it off, okay?
Okay. Yeah, so aside the vitamin K, there's also a good amount of potassium in there. Potassium is good when it comes. Potassium is actually an electrolyte. That means that it helps with balancing the fluid in our body. So it is good for maintaining good blood pressure and even good kidney function. Now, aside that, there's also a good amount of dietary fiber in there. So it is good for somebody who wants to lose weight. The dietary fiber has a way of clearing the extra fat from our body. And again, it has something we call, it makes you feel full for longer. Okay. food for longer. It means that when you eat food that is rich in dietary fiber, like cucumber, you tend to stay very full. That means that you will not feel hungry over a short period of time. And then the dietary fiber also help resolve problems of constipation. You know, there are some people that always have problems when they visit the washroom. Taking a good amount of cucumber because of the presence of dietary fiber would help solve that problem. And again, it has some amount of water in there. You see, the way you are peeling it is all your water is wet, your hand is wet. Yeah. Yes. So because of the hydration in there, it has good amount of water. So it also help maintain the fluid balance of your body. Yeah.
Okay. That's interesting. Yes. So this is a healthy vegetable. Yes. When you go to the market, don't pass by it.
Sure.
Please. We have green apples. I shouldn't peel.
Oh, you can peel.
I've told you, once I don't know the sauce. If I don't do that, I can't take it. I don't know why. I need to disabuse my mind. So it's apple now.
Yes.
Education on apple.
Okay. So you see, we are peeling it off, and then your hand is getting wet. Yeah. So it tells you that it has good amount of water. Yes. And then it's also rich in antioxidants. You know, the antioxidants are good for, getting rid of free radicals in our system. These free radicals are the ones that leads to the development of the chronic diseases, the diabetes, hypertension, and all of that. So apple is very good. You see, there's even a saying that an apple a day saves you from what? Visiting the doctor.
Yeah.
Yes, it's because of the rich nutrient content of apple. So apple actually has vitamin C, and vitamin C is good for immunity. You know, vitamin C is very good because the vitamin C actually helps the body fight off infections. And then again, if you have problems with your skin, you know, vitamin C help with the production of collagens. So these collagens actually help your skin to maintain its integrity and look very nice and good looking. Yes.
Lettuce.
Lettuce are awesome. A lot of people don't like lettuce. I don't know.
I don't know why. But it's tasty.
Yes, I really like them. I really like them. You see, they are green leafy vegetables. So the moment you hear green leafy vegetable in nutrition, it means that you're looking at folate.
Yeah.
Okay. So folates are vitamin B9. Okay. The synthetic the synthetic forms are what we have them as folic acids. So these are actually good when it comes to cell division. So I always advocate that if you are a woman within the reproductive ages, that's from 15 to 49 years, you should be taking good amount of lettuce.
No, go back to that.
Okay, so I always advocate that women in their reproductive ages, that is a stage where you can give birth, that from 15 years to 49 years, it is very advisable that you take good amount of green leafy vegetables, especially with lettuce, because it has good amount of this folate, and this folate help with cell division. Make sure that you don't have menstrual problems. Make sure that even if you get pregnant, it see you through the pregnancy period without any duress and any complications.
You see, God is a faithful God and a loving God.
Yes.
He placed all these for our good, yet we pass by it. When we are given, we intentionally take them out because we don't like them.
Yeah.
But these are the very vegetables that heals and help us.
Yes.
Interesting. So I'm adding ginger.
Ginger, yes. Okay. So, as we all know, I'm a farmer's son. My father likes farming.
Oh, really?
Yes. So I know a little bit about ginger. You know, we get ginger from the soil, like we uproot it straight from the soil. It's the roots. Yeah. So once we are taking it from the soil, we have some amount of minerals in there. So the minerals are there a lot. But let me just focus on one. That is magnesium. Magnesium is very, very essential. Especially when we are growing up, because that's when our body starts to, the ability starts to go down. And for us to kick that off, we need to get some
amount of magnesium.
Some amount of magnesium, exactly. So the magnesium would help us, okay, maintain the body processes. It is even noted that magnesium is a key component. It's around 600 chemical functions in the body. So if you are taking food that is rich in magnesium like ginger, then it means that you are doing a great good to your body. Yes.
It's very good for the heart.
Very good for the heart, yes.
Okay. And our last ingredient will be lemon.
Okay.
The juice of lemon.
Yes. So lemon is very essential. Recently I just found out that people even use just lemon with warm water to resolve issues of kidney stones.
Oh, you didn't know?
I didn't know. It was just a recent thing that I realized, and I was like, wow. It's because of the ascorbic acid in there, the vitamin C. It's able to break down those things. So any formulation, whether in the skin or in any part of the body, can help strengthen that kind of lump in the body.
Yeah. All right. So, done with education.
Yes, yes.
Time to put all these ingredients together and give you a healthy remedy to help you lose weight and to burn those cellulites, those fats around our thighs and hips. Some doesn't look nice at all. But try this recipe and you'll be amazed at the results.
Yeah.
Our healthy remedy is ready. Uncle Sam.
Yes, madam.
Are you having different thoughts? Have you put these together before?
No, please.
No.
No,
Oh,
please.
okay. It's your first time.
Yes, please.
Okay, so this is welcome to my kitchen. And over here, we put ingredients together
Yes.
to manage to reverse and to heal ourselves.
Yeah.
So this is a very simple remedy. But hey, if you don't want to juice it, you can decide to chop it and then eat it, okay? But if you really want to have that medicinal effect of it, it's always very good to be in a juice form.
Yeah.
And please listen, if you don't have a juicer, don't worry. The blender can do same. Just chop your ingredients, add a little water to it, blend and strain. If you want to take it with the fiber, that's also fine, okay? And like the doctor said, you can peel or you can decide to leave the peel on. I am comfortable when I peel them, especially when I don't know the source. We can never know the source, but if you're confident of where you're getting yours, please feel free to keep it that way. And don't forget to wash your vegetables very well. Ours were already washed before we brought them here. Just a gentle reminder, wash your vegetables very well before putting them together. All right. So, our weight loss juice to good health and longevity. Cheers.
Cheers.
Wow.
It's very nice. Yeah, it's very nice.
Surprises there.
Yeah.
Yeah.
Yes, because people don't really like cucumber because it tastes less and all of that. But then when you add it to other things, it gives it a very nice taste. This is nice. It's very nice. Yes.
It's better taken on an empty stomach. First thing in the morning, last thing at night. Trust me, you see yourself slimming down slowly and your body will firm up nicely and beautifully. So until we come your way next Saturday at 7:30, this is Welcome to My Kitchen and I'm Baba Hammond. Bye.
Bye.